Hi,
Hi.
everyone. Welcome back to... Oh,
Hi. Go back.
hey, you know what?
Stop.
I'll just cut this out.
Yeah.
All right. Hi, everyone. Welcome back to the Anxiety Chicks podcast. I'm Taylor.
And I'm Allison Sefanera.
And today we have a very special guest, a very frequently asked topic that we are finally getting to, and that is all things pregnancy. So today we have Dr. Kayla Borchers, is a holistic, orthopedic, and pelvic health physical therapist, prenatal and postpartum corrective exercise specialist. That's a lot to say.
It is.
Oh my gosh,
We're going to
fancy.
have to dive into that. And most importantly, a mother of 3. She owns and operates a physical therapy and holistic wellness private practice specializing in root cause care before, during, and after pregnancy. Dr. Kayla is the founder of the Holistically Well Method, her evidence-based signature approach to holistic women's health. You can join her self-paced preconception, pregnancy, and postpartum online programs to take the guesswork out how to exercise specific to your life season. I think that was worded a little weird, but that's an awesome program and something that we want to educate all of our followers on. And I think this is going to be a great episode. Dr. Kayla, thank you for joining us.
Thank you so much for having me.
So I think the first thing we should get into is what got you here. What led you to this type of education that we are not talked about or told about in school or even when we're trying to get pregnant?
Mm-hmm. So after graduating with my doctorate, I began working for the sports medicine department at a large university, one of the top medical systems in the world. And I just was really frustrated by the lack of proactive care. So I was seeing collegiate and professional athletes, as well as men and women just like us, who were, regularly active, but would come in and see me. And I started seeing a lot of women. I was doing running gait analyses on various patients. And I started seeing a lot of women who were in their 40s or 50s and were running, and they were coming to me with hip pain or back pain. And as we got to talking, a lot of their issues had started during pregnancy, but they pushed through them. And as we got to talking more, they're like, oh yeah, and I leak when I run, but that's just normal. It's just, once you become a mom, that happens. And I was like, hey, why are we just addressing this now? Well, the answer was because their kids were all in school and they felt like they now had the time. And then I was just like, I don't want that to be my story. Like I have run marathons, half marathons. I've just always been super active. And at this point I was engaged and knew I wanted to start a family. And so I started getting curious, and I went to my OB or my gynecologist for a yearly checkup and was like, we're getting married. I want to start a family soon. What can I do to start supporting my body proactively so I don't end up with a labral tear from childbirth or, just feel like crap, which women just have written off as normal. Mm-hmm. And she was like, well, just start taking a prenatal now. And that way, if you get, pregnant right away, you have that ahead of time. And then just go have fun. After you get married, have fun for 6 months. And if you're not pregnant, then come and see me. And that just did not sit well with me as a physical therapist with more of a holistic root cause approach to care. So as a PT, we have to do continuing education every year. So I started doing a deep dive into more women's health specific education, research-backed, evidence-based programming, and just really started putting it all together, all of the pieces together from these various places, and started to be my own first patient. And after a year of marriage, we were ready to start trying to conceive. We used natural family planning prior to that, which is cycle tracking. And I go over how to do that in my preconception program because, we don't need the pill to alter our hormone cycles. Like, our bodies were designed that we can track our fertile windows and learn that by looking at markers such as cervical mucus. So I had tracked that for a year. And when I was ready to become pregnant, we thankfully conceived on our very first cycle of trying. And that happened for the next 2 times I was ready to conceive a child. And the third time I was like, okay, there's something to this, right? Like, this is not just luck. There literally is science behind why when I'm ready to conceive, I'm able to conceive. And there's things that we can do to set ourselves up for success. And I'm not saying that's going to be the story every single time, but as opposed to the gynecologist who was like, oh, just take any off the shelf prenatal and then go have fun. Like, there is so much more to it that we can unpack today that can reduce our anxiety around that unknown. That is, am I going to conceive? Am I not? Am I going to struggle? Am I not? And just really unpacking what we can do to help.
That's literally exactly how I felt. And I think that is a God-given intuition too. Like, I think we feel that way when I was at the gynecologist and they're like, yeah, just take a prenatal and you're good to go. And I'm like, that can't be it. Like, that can't be the best way to set myself up for a successful pregnancy and also postpartum pregnancy.
Yeah.
Like, I think a lot of people don't think about like, I want the best recovery. I want the best house for my kid. I want the best house for when I have my kid, their physical house. Like, I want my mind to be ready and prepped for the unknowns and the education. And I think that's just like not given to people. So, and I think that it also keeps a lot of people from having kids and like waiting so long because they are so scared of the unknown and what all these things. So let's first talk about, so if somebody is very anxious about pregnancy, what are the first things you usually look at when approaching this type of person when they come to you?
Yeah. So we need to focus on controlling the controllables. So there are things that are out of our control when it comes to fertility, certainly, right? But there are so many things that are in our control. And so we have to let go of the unknown. We have to let go of it because we cannot say with 100% certainty, like, yes, if you have sex in your fertile window, you are going to conceive. Like, we just don't know. Like, there is a piece to this that is unknown. But if someone is wanting to reduce their anxiety around it, the first thing is we need to look at a quality prenatal. So any off the shelf, like 1-a-day prenatals are full of synthetic ingredients. They are not going to help. In fact, sometimes they can harm you if we have a certain gene in our bodies. Folic acid actually negatively reacts with our bodies and can increase infertility. So it can actually have the negative or the opposite effect of what we want that prenatal to have. So we need to make sure that prenatal has 100% folate or methylfolate, that it's the real form of folate and not where you'll see in parentheses that says as folic acid. That says,
okay, so I want to pause you right at that moment because I think that you're spitting such facts that I've read on, and it's also this thing where a lot of people nowadays have this MTHFR gene we're figuring out.
Exactly.
Mutation. So can you speak on that mutation? Do you know a lot about it? About what happens with the folate and why you need it methylated?
So essentially, when it's not methylated, when it's in the form of folic acid, it's synthetic. It's not what our bodies are used to absorbing and then able to support baby's body and growth and development, right? So I'm certainly not an expert on the full gene mutation, so I can't, break it down a ton here, but the takeaway that I want you to know is folic acid, which is not just in prenatals, it is in our cereal. It is in our crackers. Like, if you start looking at ingredient lists, it is everywhere. And so when we're talking about women
do you know why?
I think there's so much coming out now that it's like, why? Why? I don't have the answer to that. And it's very frustrating though, when we look at our processed foods and why is it put in there? There was talk a while ago, and there's still gynecologists who will say it's the same. It doesn't matter if you have folic acid or folate. And there is so much research to support the opposite of that, right?
Yeah.
And so I think it just is from the very, very tip top of large food chain and large organizations. It's cheaper. I mean, when it comes down to it, if I had to say my thoughts for why, is it's cheaper to put into products, cheaper to put into supplements instead of the natural form of it. And back in the day when we thought folic acid, or when we were told folic acid is the same as folate, I think different cereal brands, things like that, were like, look, women, this is really good for you. Like, feed yourself this, feed your kids this, because it has these vitamins in it. And so I also, if I were to guess as to why they put it in there, is because they try to market that it's good for us, when in reality it's not.
Yeah. No, I think you're right. And I think that a lot of times, I think I remember reading that the folic acid, we're told it can, with our bodies, become the folate that we need. But a lot of times that isn't happening in people.
Exactly.
And so they're taking this thing that they think is good for them, but like, come to find out, we're not even, the ingredients aren't even bioavailable to our body, and we're not even absorbing that. So that's the first anxiety, right? They're like, go buy a prenatal. And you're like, there's 50 million of them. Like, what do I buy? What do I look for? So you said start with.
Yeah, so Full Well is the one that I like to use. And if you go on Instagram and you DM me at Dr. Kayla Borchers, send me the word nourish, and I will send you a guide that has links to my favorite prenatals, favorite protein powders that are clean. Like, literally my job is to take the guesswork out of it for you, because I was in your shoes. I was where you are, where I was anxious about this. I was like, I want to have a healthy family. I want to have a healthy pregnancy. I want to feel good. But where do I start? And to be honest, I didn't start in the right place with my first pregnancy. The prenatal I took was marketed as organic. It was the Rainbow Light, and it's marketed as organic. So I took it my first pregnancy. Come to find out, as I did deeper work, it has folic acid in it and not folate. And I was tricked, right? So I have since switched to what's called Full Well. Again, if you DM me the word nourish, I will just send you all the info so that you have it at your fingertips and you can set yourself up for success from the very start, and you don't have to kind of go through the different guesswork that I had to.
So amazing. Well, I'm just even thinking about not just any supplements. I'm just thinking even of the different supplements that aren't even prenatals, where it's the same thing. There's so much synthetic stuff in all different type of supplements that I've had to learn. Like even with certain vitamins, like you think you're getting, vitamin D naturally or something, and there's all these other synthetic things in it. But so that's very good advice.
So what I'm really looking for when it comes to supplements, and even in my food sources, is it third-party tested? So when you are buying supplements, it 100% should be third-party tested. And so as Allison was saying, like, we want to make sure what is in our supplement is actually what's in it, because it's not regulated. It's not regulated by the FDA here in the United States. And so if I'm getting collagen, or if I am getting a prenatal, I want to know what is in it is what they're saying is in it, and that there's no added gunk in there, such as pesticides or fillers, that the company is not clear on, right? So third-party testing is what allows us to know that information.
Man, that alone, that could be like, okay, guys, we're done with this podcast, because I think that alone is just so much information to someone. And then you also talked about in the very beginning. So since we've started with prenatal, so that can help your anxiety there on the right prenatal to get. Moving on, I think the next anxiety component people have is delivery. You're pregnant, and that's the thing, the day you're looking forward to, right? But you're also like super fearful of, because you hear all these stories and about tearing, and what is tearing, and what are all these things. And like you said, and I don't think I've ever heard this before, that you can prepare yourself to almost make it to where you don't tear.
Yes. So as a pelvic floor physical therapist, this is such an important part of my work. And it really comes down to what we do during pregnancy to support our bodies. So when I'm working with women one-on-one, and then also through my pregnancy program, I'm educating on how we can help with pelvic floor mobility to prepare the body for childbirth. Because if we were just sitting here right now and I said, let's go down into the splits, I want to see you go into the splits, and you're like, okay, this is as far as I can go, and I just put my hands on your shoulders and I force you down, we're probably going to tear a hamstring, right? Like, unless you're Simone Biles, like, we're probably going to tear a hamstring, because our muscles weren't ready for that. We were just sitting still here. Like, why are we expecting women to do that to their pelvic floors during childbirth, right? We're expecting a muscle to go from, it's a circular muscle, and just expand for the size of a baby's head and body to come through, right? That is why so many women tear. So in my work with women during pregnancy, ideally I start working with you in your second trimester because muscles take time to evolve. Okay. So if we just look at, 2 weeks before I'm going to prepare my body, we don't know when baby's going to come. My last baby came at 38 weeks of pregnancy. So if I started 2 weeks before my due date, baby's already here. Due date is an estimation, okay? So let's start in the second trimester with hip mobility exercises. Our hip is very intertwined with our pelvic floor. So if we have tight hips, we have a tight pelvis and pelvic floor. So that's what we start from the earlier end of pregnancy. And then breath work, actually learning how to inhale into your pelvic floor and feel the pelvic floor descend and relax. When we breathe in, our diaphragm drops. It pushes all of our internal abdominal contents down. That's why our pelvic floor should lengthen. And then as we exhale, it should recoil up and in. So we breathe all day, every day. The more just gentle movement we can get at the pelvic floor, the better. And then really in the home stretch of pregnancy, when we're looking at later in the third trimester, that's where we implement things such as perennial mobilization. This is a technique that you can do on yourself. And this involves actually stretching the pelvic floor muscles so that they can literally mobilize ahead of delivery and childbirth.
Wow. Why are we not taught these things?
I know.
It's almost like unreal. Like it really is.
Yeah. I know, it's mind-blowing.
Crazy.
That's so cool that you learned all that and you share all that with people, because I think that this already, like I said, these two components help people right now. Even I'm in the childbearing ages of like right now I'm like thinking, I'm like, like that's a relief, like set up for the prenatal, set up for the delivery. So I came back to another thought when you were talking, is another thing to hit on is when you're going to get pregnant or try to get pregnant, a lot of people are like, what can I do besides a prenatal to prep my body?
Yeah. That was like, we really went deep there, which was great, but there's so much more to it. And so stress is a big part of it. When we're talking about stress and anxiety, our body needs to feel safe. If we think biologically how we're primed, our body knows it can't support a pregnancy if we're in a state of chronic stress. If we're in fight or flight mode all the time, and our body perceives stress the same. So whether it is stress from work or stress about getting pregnant or stress because you're not sleeping, whatever it might be, right? Our body perceives that as it is not a safe time to start growing new life within us because we can't even take care of our own needs. So stress management, which is where, mental health is so important. And I love the work that you guys are doing in that area. And then exercise, under versus over exercising. So my undergraduate degree is as an exercise physiologist. So this is an area I am really, really well versed and deep dive in with my clients as well. But I see women that are chronically over exercising, so their cycles are irregular and it's harder to track those fertile windows. Or I see women who are under exercising and then blood sugar becomes an issue. Our hormone balance becomes an issue. So stress management, right? So we have to find this happy medium, and that's going to be different for everybody. So helping you find that for yourself. And then nutrition. So we talked about a prenatal and supplements, but nutrition in and of itself is super important. Having collagen-rich foods, having high protein intake, that is all going to set ourselves up for success. And then the other piece of the exercise puzzle is actually doing exercises that are going to optimally support your core and your pelvic floor ahead of conception so that you actually feel good during pregnancy. So I am doing specific hip stabilization exercises, a lot of really good deep core work leading up to conception so that once I'm growing a new life within me, my body's ready to support it because I've exercised these muscles appropriately ahead of time. And just to kind of inspire you as you're listening, like I literally hiked in Banff National Park at 20 weeks pregnant with a 40-pound toddler on my back. No pain, no leakage.
Oh my gosh. Okay.
So like our bodies are amazing, right? Like
No, they really are. Like, I think that's why it's so important to have you on here, because I don't think people realize we are made for this moment. It's just how we approach it. It's like you said, it's almost like if, like you said, you were a marathon runner, it's like if I randomly just got up tomorrow and said, I'm going to go run a marathon, I'm going to feel a lot worse than you feel running a marathon.
Yes.
And so I think that this is so important to educate people on the things that are available. And so I had another question that just popped in my head. What's the difference between you, or would you utilize you and a doula?
Great question. So the difference between me and a doula is going to be there at your childbirth. So I am educating you on things ahead of time. She's not going to program your exercises. She's not going to do any kind of manual therapy or myofascial release or education in that realm. She is going to be present at your childbirth. And some doulas will have prenatal visits like leading up to your delivery. And those visits, they'll discuss, what is your birth plan? Like, what are your preferences for delivery? Do you want an epidural? Do you want to go natural? Here are like some pain relief strategies, such as squeezing a comb, so that you feel the pricks of the comb instead of the pressure of the baby. I will educate on some of those things leading up to childbirth as well, but I won't be at your birth, right? So that's the biggest difference. And then we both can also touch base on birthing positions and things like that. And I practice that with my clients and within my pregnancy program, but I'm not going to be at your birth. Your doula will.
Okay. That makes sense. Okay.
I also have another question too. I don't know if you had a follow-up, Taylor, to that, but I have something before about the exercise thing. And you kind of mentioned balancing of exercise, which is, I really like that you're saying that out loud, because I feel like there's probably people listening that would like to hear that more from other people and professionals, that like you have to find a balance. It's okay not to have to go and do all this hardcore exercise or different, so could you, like, what would you recommend is like a balance? Does it depend on the person, or what would be over exercising? What's an example of that versus under exercising and all of, I'm just curious.
So my story is an example of over exercising. So I had one period a year from age 16 to 20. And I was a huge runner, right? Like that is pretty much all I was doing. And so I realized like I need to pull back from so much impact work. And so for me, that looks like my body's really happy. It all comes down to tracking your cycle. Okay. So I was tracking my cycle and realizing that obviously one cycle a year is not normal. And I knew that. So running 3 days a week, and then on the other days doing a Pilates or bar or yoga. So non-impact activity. And so with a lot of my clients, we fall into this sweet spot somewhere. So we have about 3 to 4 days a week that are impact work. So whether it's plyometrics, high intensity interval training, or running, you're doing that every other day. So on non-consecutive days, for instance, Monday, Wednesday, Friday. And then on Tuesday, Thursday, Saturday, we are doing non-impact work. So you're going to your Pilates class. You are doing my exercise programming from the comfort of your own home, where I'm taking you through specific routines that are activating a lot of your deep stability muscles for your core, your pelvic floor, your pelvis, your hips, your glutes, so you feel really good. And that does wonders in terms of hormone health for women. So we are taking our body out of that sympathetic state, that high drive, which we get into with running and impact work. And then we're calming our body with more parasympathetic rest and digest nervous system work in these more like rehab cued or Pilates based movements that I program. And then we're taking it back up. So that is the sweet spot most women fall into. And in terms of how much intensity work you're doing, that might look like running 6 miles for me, but that might look like a brisk walk for somebody else, right? And that's where it gets unique for each person.
Yeah. Awesome. I love that. That sounds honestly like a plan for anyone, not even if you're thinking about getting pregnant. It sounds like a good exercise plan for everybody. Like that's
longevity.
Yeah.
It's something you can maintain versus burning yourself out because you're going, hard for 5 straight days, and then you have to have 10 days to recover, and then 5 straight days hard. I see that in a lot of women. And yeah, so realizing it's a balance and you can maintain it and feel really good doing so.
I know we have so many questions for you because you're so empowering for women. Just to have this type of education is probably life-changing for people. I know a lot of people nowadays, just even like speaking with friends and stuff, want to do natural births. And I think that sounds very scary. But I think that I'm assuming with your program and things like that, you can really be prepped and it can be almost easy.
Yeah. So my first delivery, I did have an epidural. So I want to say like I've been there. That was, and it slept in almost 48 hours. And like, that's what my body needed. And that's okay. My second two were 100% physiological fetal ejection reflex births. So my second childbirth, I was on all fours, so like hands and knees position. And this is something in terms of preparing like for a delivery too. We want to be in positions that maximize your pelvic opening. So we talked about the muscles, but we also want to think about the bones of your pelvis. So if we're on all fours, they can expand in all directions, right? We're not lying on our back in stirrups where the bones are anchored against the bed and can't expand, right? So I was on all fours because I knew this and I wanted to give my pelvis room to expand. And what's incredible about childbirth when we do go 100% natural is that there's something called the fetal ejection reflex. And you don't even try to push. Like your uterine contractions just naturally push your baby out and like you literally can't control it. So that is my story with number two. I literally got to the hospital, crawled on the bed, and he was delivered. My husband almost missed it because he had to drop me off at the door and he like ran in.
And you didn't tear.
And I didn't tear. And I did not tear. So a lot of that comes with
So
like
how long did you
breathing
labor?
baby down. It was like slow labor throughout the day. I worked my PT job during the day until 7:00 at night. And then went home, labored. I love your guys' faces right now.
No, that just goes to show you, like literally that you can prep your body. There, if you put in the work, the outcome can be very nice.
Yes, absolutely. And I didn't do as much prep work with my first baby. Like I was just starting to learn all the things, right? And the more you learn, the more you know. So I knew more my second. So yeah, I had more intense labor then, until like from 7 to 2:30 a.m. And that was, at home. And then he was born within 15 minutes of getting to the hospital. And that was me kind of breathing baby down so that it wasn't just bearing down, pushing. I think that's why a lot of women tear too, is they're cued to push. In reality, you just need to feel your body's natural instincts and breathe baby down with like an open breath where we're not bearing down and like physically forcefully pushing, if that makes sense. And my third child was delivered in standing. So I was literally standing when I birthed him.
How can you even stand?
I was like squatting.
Oh my gosh. Were you at the hospital?
I was at the hospital. Yep. In the bathroom. So it happened very fast. They were filling up the birth tub. I wanted a water birth.
Yes.
And I was really excited to get in the tub, and I went to the restroom and I was like, I'm just going to go to the restroom. They were filling it up and I wanted something to take my mind off of them filling the tub. So I went to the restroom. My bag of water fully burst on the toilet. And I just immediately got that fetal ejection reflex where I felt the need to like breathe him down and delivered his head there at the toilet. And then of course had to stand up, and that's why he was delivered in standing. So my team literally had to come into the restroom in the hospital to deliver him. But it was incredible. Like, just again, like our body is designed for this. And yeah, that's not the normal birthing position that we see in movies and that we hear about. And again, I did not tear. And
wow.
Yeah. So it can be done. I like to say it's pressure, not pain, and just really thinking to breathe baby down.
Sorry, I'm just like, breathe baby down. Okay. Can you explain that again? Maybe in pretend I'm like in 5th grade or something.
Yes.
I am still confused by what that means.
Sorry, there's neighborhood kids here. I'm like,
oh, it's okay. I'm like, I'm like, what's happening? You look like you're talking to your dog to stop barking or something.
Exactly. Okay. So when we are having contractions, our uterus is a muscle literally helping bring baby down into our birth canal. And so breathe baby down is a cue to really think, inhale, my pelvic floor descends. Exhale, we're just going to think downward pressure. And so part of it's this like mind to muscle connection.
Okay.
Where we're visibly thinking about breathing baby down because it's physically what's happening, right? But what I also mean with that is to not do what's called closed glottis breathing. So that's essentially bearing down. You're closing the back portion of your throat and you're pushing that way because that's what we see a lot of women do. And that just increases pressure. And actually, when you do that, if you try that right now and just like bear down and push, it tightens things down there. Like instead of relaxes them, right?
Yes.
I was thinking if anything, it might even stress the baby out.
Totally. And that's where, you know, sometimes when they're monitoring baby during pushing, they're like, oh my gosh, baby's heart rate's dropping, or, you know, baby's in distress. It can literally be because we're just bearing down and tightening everything there versus like easing baby down and like having this, again, what's called open glottis breath and just breathing baby down further into that birth canal. You can literally feel where your vaginal opening is expanding as baby's head kind of pulsates in and out. And that helps just gently expand the pelvic floor for a tear-free delivery.
And did you tear your first one?
Very minimal. I did not need stitches, but a little bit. And again, that one was epidural and I was on my back. So, you know, that's a big difference. Yeah.
Yeah.
I can imagine though, too, that as someone who's never experienced labor, and I think about anxiety and how we were just talking about this on our live, how I think the actual labor gives me more anxiety than like 10 months of pregnancy or even having a baby after that, right? It's like that part of it and just thinking about the trauma that, and it's not, I'm not even picturing a movie because I've seen my sister, I've seen people I know like actually in labor. So I know what it looks like. I've seen, and it seems like traumatic. And I don't want to say in the sense of like, for me personally, it seems very, very scary, but I'm talking about trauma in the sense of it is a trauma experience for your body it's very natural for women have been doing this since caveman times. Right. But it's a traumatic experience for the actual body. Right.
Sure.
Because of so many things that are happening. So it makes sense. The whole breath work and all of that is something I was talking about too. It makes sense that would be such a key kind of coping tool or something to practice and getting practicing a way to do that you know will help you in that moment, right? It makes sense from a psychological perspective that the body reacts like everything starts with the breath, right? So when you have anxiety, the breath gets shallow, right? All those physical things that happen when you get anxiety, even when you're not pregnant. And just imagine going through labor and having those things, right? So it's like that makes so much sense why that would be one of the most important things that you'd want to practice during the actual labor.
For your mentality to come back to, I've been here before. Like I have worked on my breath before. I can feel calm. I trust my prep work, right? Like mentally, that helps us let go of so much anxiety surrounding childbirth too, because you've prepared. It's just like showing up to the starting line for the marathon we've referenced, and you haven't trained a day in your life. You're going to be scared out of your mind. Like, what did I just sign myself up for? Versus if you have prepared your body for 9 months and you just feel so confident in that brain to muscle connection with your pelvic floor and you're breathing and you know how to breathe for your vagus nerve and keep yourself out of that shallow breath, which brings us into that fight or flight stress response. Like you're going to trust your body a heck of a lot more when you show up to Labor Day, right?
To be completely honest too, just from a perspective as someone who does a lot of breath work with my clients and have just like practiced it on myself and, you know, as a psychologist, it is such a practice that if you're listening to this or watching this and thinking that, okay, I'm just going to do this maybe a week before my labor and I'm almost going, and then I'm going to be like, oh, I got this breath work down. Breath work has to be something you really, in order to make it habitual, to breathe a certain way and make it a habit, you really, really have to make it a daily practice for like months. So I would start really teaching yourself how to breathe in the way that you were talking about, that gets more oxygen to your brain, from your belly, and helping you understand more about what it feels like to actually breathe in a way that's helping your body stay balanced and helping your brain stay balanced, right? So it's just
Yes,
something that really I encourage everyone that I work with to do on a daily basis, and not just start and stop it, but to just create a habit of breathing differently in your life.
absolutely.
Yeah. And I think the final thing I want to touch on, because I've actually read a lot on this, and I was talking to my mom about this and talking on the live about this and how we're seeing this not uptake, but I wouldn't say there's an uptake, or maybe there is, I don't know, of postpartum depression and anxiety. And I think a lot of that can be prevented. And I think a lot of it is in the lack of education and just being more educated. And also, like, I don't know, maybe this is conspiracy theory or whatever, but I've heard of the link of epidurals. And I don't think a lot of people are educated on that. What have you heard on it?
Yeah, I mean, you're right. It's rising in terms of postpartum depression, postpartum psychosis, even. And a drug recently came out within the past year that was touted as the savior. Though, thank goodness there is, a pharmaceutical for this now. And I got kind of mad, to be honest. It was like, we know that exercise can have the same effect on the body as a drug. Like, literally, we were taught that in my physical therapy education.
Yeah.
And so why are we treating pharmaceuticals as the answer, right? Like, when we can talk about things like breath work, as you mentioned, Allison, that literally taps into our vagus nerve to take us out of that fight or flight mode. When we can look at exercise and simply going out on a walk with your baby, getting fresh air, sunlight, vitamin D, all of these things are natural and are available to us. So, in terms of epidural being linked to that, it's a pharmaceutical. It is. And does that mean if you have an epidural, you are going to get postpartum depression? No, absolutely not. I, again, had an epidural with my first, and I did not have that. But I would say I had a lot more anxiety. Like, I had a lot more anxiety with my first child. Is that because I was a first-time mother or because of an epidural? I don't know. We will never know. But with my second and third, even though there was more overstimulation in my life, my third is 7 months old right now, so he's still a baby. There's a lot more stimulation in my life than when I had one baby, but I feel calm and I feel very capable of managing it. And I think that comes back to this holistic approach to managing my own care and that of my patients. Is I'm looking at exercise, nutrition, fresh air, vitamin D, supplements, and how all of these things work together to holistically support my health. And that's where my holistically well method and approach comes into play. Is it's not usually just one thing, right? It's all of these things working together to help us feel our best so that we can stay calm on the really hard days, because there's going to be hard days in the postpartum season for sure. But it all comes back to how we manage that, right? And like, we can manage that in a calm way, or we can go into where we struggle with that mental health component, right?
Yeah, I think I'm just really big on that, like, root cause, right?
Yeah.
When I see something like we're seeing an uptick, we're seeing this, we're seeing that, I'm like, why? Like, my first question is always why, and not like you said, like there's that new pharmaceutical, and you're like, okay, wait, we're putting a Band-Aid, but why is this happening? And like, I personally haven't looked into like any research. I don't know if there is any evidence as to why. Because like my mom said, like when she had me and my brother, she was like, it was literally the best time of my life. She was like, I was the happiest I've ever been. And I'm like, it's so interesting how you hear that more back then. She goes, I never even heard about postpartum depression. I never even heard about postpartum anxiety. And I'm like, okay, maybe it was a thing and we just didn't know and people had it. Or what is the cause of the uptick and what can be done? I all those questions just jump in my mind.
Totally.
Yeah.
And I think there's a lot of pieces to the puzzle, and it can loop back to the beginning of our conversation where there's synthetic ingredients in so much of what we're putting into our body. So I think part of it has to deal too with how women are nourishing their bodies before actually conceiving. So our body pulls from our nutrient stores the 3 months prior to conception. So ideally, I start working with women 6 months before they're planning to conceive, because we want to get that really high quality prenatal organ meat, beef liver, bone broth, collagen, like all of these really nourishing ingredients into their body so that baby pulls from those energy stores during pregnancy and not from like mom's way back stores where mom gets depleted, right?
There
So we
you
want
go.
mom to be
Yep.
nourished throughout pregnancy. We want baby to be optimally nourished. We don't want to deplete mom in the process of nourishing baby. Okay.
I think you just hit the nail on the head. I think so many women are depleted, and then
Yes.
throw in a baby, they're just draining you completely, and then you're left with nothing.
Yep. So if we're
Yeah.
talking about root cause, I think that's really what it comes down to, is we
For
actually
sure.
need to start preconception.
Yeah.
Yes.
And then we can set ourselves up for so much more success on the back end.
Yeah. And I mean, don't forget, just putting my like therapist hat on and psychologist hat on for a second, everyone's brain chemistry is so different. So anyone who might be predisposed to anxiety or depression as a young adult or a child, right? An adult who is going to be more predisposed to having postpartum anxiety or postpartum depression. And a lot of that doesn't just have to do with, having a child makes me happy. It's really the brain chemistry and a lot of what goes on biologically to you also when you have a baby, and the hormones and things that change, that isn't just about some of these holistic things. They try that and it just doesn't work. So I'm a holistic psychologist, but I do want to mention that pharmaceuticals can be very helpful if it's prescribed appropriately and taken appropriately from certain women. There are certain women that wouldn't be able to do all of this and maybe not even get out of bed still, whether they have a baby or not. You know what I mean? So you just kind of have to throw that like disclaimer out there that it sounds like a great plan, but for some people it's a lot more debilitating, and there needs to be more and more support than maybe someone else would need, right? So everybody's so unique, but the brain chemistry, like biology, it's just different for everyone.
I think that's a great point, Allison. And I am totally pro like modern medicine as we need it, right? Like we need to use these holistic approaches first. But yes, there's going to be a subgroup of people who need the advances of modern medicine, which is incredible. So let's use it when appropriate. The same is true for physical therapy, labral tears, all of that. Like it's incredible that these surgeries exist when women need them and when people need them, but let's do what we can from a holistic approach and not just jump straight to the pharmaceuticals. So I think that's a great point to bring up.
Yeah. I totally agree. Well, Dr. Kayla, thank you so much. Allison, did you have any other questions?
No, this is all so enlightening and even crazy that I'm like in my mid 40s and I've taught myself so many things about having kids. I've gone back and forth about wanting it or not, and talked to different doctors and talked to my friends, and of course, personal experience of people that I've had, and literally learned all these new things today. It's crazy. So thank you. No, you really answered so many things.
Yeah, Dr. Kayla, you're very empowering to women, and what you do is really, really important. And that's why I wanted to get you on here. I mean, I don't think a lot of people have the time to just go and do all this research. So they really need people like Allison and I who can navigate people to people like you who can just be that resource for them. And there doesn't have to be all this anxiety around pregnancy. Like we are made for this moment, and it's just about empowering yourself and having that education. It can be life-changing to your pregnancy. And that's what I focus on.
I wanted to say one more thing. I'm sorry. So we have a healing tip of the week that we do every week. And I just wanted to, and we're getting more guests on, and usually I'll give the healing tip of the week, but I love to have our guests have the opportunity to give our listeners just a nice healing tip that maybe they can start with and what they take away from this episode. And I'd love to hear if you would recommend a healing tip for the week.
So fun. So I would say control the controllables. And I said this earlier, but I want to come back to that as the healing tip of the week, because when we talk about anxiety surrounding this perinatal life season, you can go down so many rabbit holes. But coming back to, I'm going to control what I can control. I can control what food I'm putting on my plate. I can control whether I go get a 30-minute exercise in today, or if I sit and scroll my phone after work instead. Like, let's control what you can control and let everything else go.
I love that. Thank you.
Yeah.
Amazing.
And you know what's funny? This is my quote of the day, and we didn't even like talk about, like, her and I didn't like chat.
No, I don't know what it is.
It says, you can't stop the waves, but you can learn to surf.
Gosh, I love that.
Those tie in together so well.
Tie in very well.
I always kill it with the quotes. I love it.
Yeah.
Oh, thank you so much. And tell everyone where they can find you.
Yeah. So thank you, ladies, for reaffirming this work that I do. I am so glad to be a resource in this area. So if you go to drkaylaborchers.com/resources, I've got free guides specific to each season of womanhood. So preconception, pregnancy, postpartum. Get a guide specific to the season you find yourself in right now, and I will help give you more tips specific to that timeline. You'll also find all of my programs there, and you can dive into immediate support. So I've done all of the research for you. All you need to do is join and press play and begin learning how to nourish, exercise, support your body holistically for this life season. Also, you can find me at Dr. Kayla Borchers on Instagram. Give me a follow.
She's so cute.
Let me know.
Yes. We'll put this all in the show notes too, so everyone can just click. Yeah.
But yeah, I love connecting with women and just really helping you along your journey. So thank you so much for having me. It was so fun.
Thank you.
Thank you for taking time out of your day.
Totally. Yeah. No problem.
Yeah. We usually go like 35 minutes and we just went 50 minutes because you gave us like literally the first 10 minutes. I'm like, okay, cut episode, like education's done.
Amazing.
So, all right, guys, we'll see you next week.
We'll see you next week. Bye.
Bye.